find a way.
Helen Scott, the executive director of Healing Hands, which is one of the, I would consider one of the more important nonprofit organizations in town, because you guys you're delivering such an important product, which is healthcare and services. And you've learned how to do that at a pretty significant scale. And so we're 27 years into this organization. You have been the executive director for 21 of those years. You've seen the growth, you've seen the challenges, and I'm really, really interested to see that from your perspective and the stories involved. So, but first, I want to know about your story. What led you to here? So where does Helen Scott's story begin?
So I would say that my story begins, I was born in Bristol. I majored in what was at the time called transportation, which is now the logistics is what they call it now. And I really wasn't sure what I wanted to do, but I lived in Huntsville, Alabama for a little while and met my husband, Bob. So we got married and I wanted to move back home. So we moved back to Bristol and then had two sons, Sam and Brian. And
at that point of your life, what were your dreams?
I knew I wanted to live in Bristol. I knew I wanted to move back home. And
you had all those roots here.
Yeah. I knew I wanted to be back home. And so that was really at the time, I didn't know what I really wanted to do. I knew I wanted to be married and have children. And so I was a stay-at-home mom for a while and was real active in the community. But I also wanted to say, when Bob and I got married, we got married in Central Presbyterian Church that my relatives founded. And my oldest sister got engaged at the same time. So we said, let's just all get married at the same time. So we had a double wedding. And so Dad walked Julie down the aisle first, and then he turned around and came and got me, and then walked me down the aisle. But it was a lot of fun.
Yeah.
So then when our two boys were born, they were baptized at the church. And let's see, I'm trying to remember then, anybody who's passed away, my dad passed away, and all the different funerals we've had there. So, but anyway, I was a stay-at-home mom, and then the church asked me to come work for them. So I was working at our church, and then I had two members, friends that were members of our church, say they were looking for an executive director of Healing Hands Health Center. And so they saw that I worked really hard at our church, and I did a lot of fundraising through Junior League, through the PTA, I was just really active. And they knew that Healing Hands needed funding. A nonprofit always needs funding. And so they just came up to me and said, we think you'd be good at this and we need somebody. Will you come interview?
Yeah.
So I did.
What skills? You were in your 20s at that point.
Mm-hmm.
And
I was probably in my 30s at that time. 30s.
Looking back, what skills do you think you had then that maybe you didn't recognize in yourself?
Relationship building, knowing people and wanting to get to know people and wanting to know who people are who I didn't know, making an effort to meet people who I wanted to know who they were. I have a genuine interest in other people.
So like a curiosity. You have
I have a curiosity about people and wanting to know people.
Yeah.
I wasn't especially interested in school learning. I didn't have a drive to become a particular, I didn't want to be a doctor or a dentist or whatever, but I knew that I just liked people and wanted to get to know people. And if I didn't know somebody, I was very brave about talking to them and tell them I wanted to get to know them. So I really think relationship building helped me more than anything else, because that's what you have to have in fundraising.
Leah Ross was on a couple of weeks ago, and the director of the Rhythm and Roots, the big music festival.
Yes.
And it's kind of a similar trajectory where in her 20s and early 30s, she wasn't sure she hadn't found her passion yet.
Yeah.
And she said that the volunteering is a great way to open doors and find out who you what you really want to do, and connect with the right people.
So yeah, I agree with that. Very similar. I did a lot with junior league, did a lot with PTA, school, church, so I would agree. I am similar to her trajectory.
I mean, it's tougher for females who want to have a family because it sometimes keeps you from being 100% career focused, but that doesn't mean you don't have ambitions.
Yes.
So how do young women find that place and find that vocation?
Help you. Some people help for you. I wouldn't necessarily have applied for the job at Healing Hands. I had people who recognized in me that what they saw was what they were looking for. So, knowing people, and they told me they thought I'd be good at it. So I thought, okay, I'll try.
What have you learned about connecting with people and forming those relationships?
I think I've learned a lot that not everybody is good at it. Really. Some people hold themselves back from meeting other people because they think maybe they're out of their league, or I don't know what holds people back from that. But, I just really think it's fun to meet people, and people from all walks of life, or whether it's our patients that get help from our clinic, or donors or volunteers.
I think I find that people that do have that gift, like that curiosity and that kind of that connector gene, like they can connect people in the community. It's easy to discount that and just assume, anybody can do this. This isn't really a skill. But when you look around at the community leaders, most of them have that skill. Like they might not have gone to school for anything in particular or a technical skill, but that connection, that ability to make those connections, that curiosity about people, it's a real powerful, valuable skill.
So my dad had it. I'm very similar to my dad. So in banking, he did volunteer work for the church and the Chamber of Commerce. So I'm very similar to my dad.
Yeah.
And I learned it from him.
Right. Yeah. So you kind of stumble into this thing called Healing Hands. Tell us about that. Like what was it when you found it?
So I was so green, and I didn't have a lot of help when I started because Frank DeFries, who was a member of First Presbyterian Church, gave $100,000 to help get it started. So that was huge.
And this is 27 years ago.
Yes.
Yeah.
So there was the executive director two before me, and an employee, and then a part-time nurse. So there were 3 employees, counting myself when I started.
So that's a small.
Yeah, it was very small
operation. Did they have a network of physician volunteers?
Had volunteers only.
Okay.
Only volunteers. Jackie Burt from First Pres was the first volunteer medical director.
Okay.
So she would treat patients. And Jewel Bell, who was a early volunteer, talked to me one time. I saw her. I was a guest speaker somewhere, and she came up to me and she said, "Helen, I got to correct you. You said that the first location was where Abuse Alternatives is now." She said the first location truly was at First Presbyterian Church because a few people were seen as if it was a doctor's office, but they were seen at the church. So,
right.
But
so it's this is a small administrative team.
Small.
When you got there, starting to attract volunteer physicians that could actually provide the services.
Yes. And Healing Hands started as a medical clinic, but also a dental clinic, vision clinic. We did eye exams and eyeglasses. And then it also had chiropractic clinic and gave out medications. And not a lot has changed that part of it. It's just grown tremendously. So we've added a few services, and I'll talk about that. But so it took a huge group of volunteers. So not just medical volunteers, but dental, vision, people who knew pharmacy.
And you didn't have you didn't have a big team to start with.
Right.
What was the hardest part when you got there?
I think the first thing decision making of, and I remember
in terms of strategy.
Yeah. Where do we go from here? We're so small and we got a long way to go.
And the problems are enormous, right?
Yes. We didn't have enough money because $100,000, doesn't go real far. I mean, it was huge to get it started, but I came in 5 to 6 years later. So just really finding more funding, more volunteers, trying to make the right decisions.
But you said decisions was the hardest thing.
Yeah.
And I think nonprofits, if they don't make good decisions, they can raise money and not really make any progress.
Yeah.
Sometimes raising money is the easier thing.
Mm-hmm.
Having a clear strategy is the hard thing.
Yes.
So what were the choices, like when you go back to that time when you started? It's small. The problems you're trying to tackle are enormous.
Yes.
Right? Like you could go in any kind of direction.
Yeah.
What were the big strategic choices at that point?
You mean that potentially helped us be successful?
Yeah, that first step.
Yeah. I guess, there were just so many different things to do, but remaining true, doing it all and remaining true to our being a Christian ministry. And people have different ideas on where something is supposed to go.
Mm-hmm.
And we started out as completely free. We help people who don't have health insurance. They don't have medical insurance, dental insurance, vision insurance. And we had no income coming in because it was completely free. And there are costs associated. So we changed from going from a free clinic to asking for donations, and patients weren't really giving donations, to charging something. So that was one strategic thing and I feel very strongly we did the right thing.
How long did that take to figure that out?
So it took a while.
Yeah.
But I feel very strongly that was the right thing. I remember a patient saying, "Thank you so much for charging me something. This way I don't feel like I'm taking charitable care." Because a lot of people are really proud and they felt better of giving something. It's a lot like a copay. So we started, right now it's $50 to see the dentist, whether you have 1 tooth extracted or 5. It's just a flat rate to see the dentist. It's $25 to see the doctor. It's $25 to get your teeth cleaned, but it's no charge if you don't have the money. So we remain true to that free part. If somebody says, "I don't have the money to pay," then we say, "Well, come on anyway." So we tried to remain true to that part of it. And it's $5 for medication. And people appreciate, we feel like, when they have to pay something. So we do eye exams and eyeglasses. And so when I was new, we'd have people that would say, they'd say, "That free pair of eyeglasses I got, I broke them and I need another free pair." And then we also saw people who paid $25 or who got their teeth cleaned for free, and now they pay $25 to get educated and get their teeth cleaned. They take such better care of their teeth.
Yeah.
They value it more.
Yeah. We talk a lot. A lot of the conversations have had to do with ownership, and people that have ownership in something just are more invested in it.
Yeah.
I suspect that's with their health.
Yes.
As well.
Yeah.
So even those small amounts. And so going back to the beginning and like that decision in particular.
We had some volunteers quit.
Yeah.
Not everybody agreed with it.
So
we had people quit.
Yeah.
I'm not going, it was founded to be a free clinic. You're charging. I'm leaving. So people came to the board meeting and complained.
Yeah.
But I do believe it was the right decision. You can't make everybody happy, and not everybody's going to agree on the same things.
Yeah. My experience with nonprofits has always been a similar frustration in that it's so hard to align everyone's interests. You got a board, got a board of 12 people or whatever it is. And you throw their faith into it, a faith-based organization. There's 12 different opinions on what a Christian-based clinic is, right? That's 12 different opinions on that.
Right.
And aligning, like, whether is it free or do you pay? I've always found that that's the toughest part with nonprofits, is getting that alignment.
Yes.
You talk about how you did that early on. What worked to get people rowing in the same direction?
I think there was such a great group of volunteers, people who really want to volunteer. We have some people who volunteer because maybe they got a speeding ticket or because their parents said it'd be a good idea if you go volunteer, whatever. But early on, there was a tremendous group of volunteers who really wanted to be there, and they felt ownership in it. But a lot of them got on board with whatever we felt like. But they saw how the clinic, how we were growing, and we needed more money, and they couldn't give it to us.
And they saw the needs up close.
Mm-hmm. They saw the needs and the gratitude of the patients. We have patients that just cry with gratitude because they are so grateful for the care, and they just feel valued, and people really appreciate Healing Hands.
If you go back to 21 years ago when you came on, were the needs different than they are now?
I think there are some needs that are different now. I think people, I had somebody who moved away and then has moved back to Bristol, and they just think that it looks like there's more people in need now.
Mm-hmm.
Things are so much more expensive, and there just seems to be a lot more need now.
Yeah, I think that too, and I'm curious what the reasons are. I think culture has changed. I mean. Mm-hmm. You're a volunteer-based organization. Mm-hmm. Like most of your medical providers.
Today, we have 27 employees.
Wow.
So now we have more employees than we do volunteers. So we have 27 employees, and our annual operating budget is $2.2 million. And we've started a $4 million capital campaign. But back to the volunteers versus employees, a huge thing that we did was, and this kind of shifted our volunteers a little bit, we have 126 students that rotate through our clinic. So we have 13 dental operatories. So dental is bigger than medical. And so
those students, what kind of students are they?
So the first group we partnered with, and that was when very early, ETSU dental hygiene students have rotated for 21 years. And so they drive over and clean people's teeth and drive back to Johnson City or to where close by. So we have partnered 10 years ago with the University of Tennessee College of Dentistry in Memphis. And Dr. Rick Guthrie was very instrumental in that, helping us. He's a longtime volunteer. And so I'll say seniors, they call them D4, their fourth year in dental school. That's why it's the D. Mm-hmm. So D4 students come 4 at a time, come for 2 weeks from Memphis to Bristol and stay 2 weeks. And they've done that for 10 years. So they stay. We had a 2-bedroom house first that we housed them at no charge. Then we did our second capital campaign, and we built a student dormitory. We can sleep up to 14 students in it. It's really incredible.
So you've built a dormitory to staff students that come here and take care of.
Yes. So it's across the street from the clinic, and they walk across the street at 5 till 8 and start helping at 8 o'clock. So we are educating dental students. So that was 10 years. Then we have just about every university or college around, we have students that come. Appalachian College of Pharmacy students, Wytheville Community College dental hygiene student.
I think that's interesting because I think people perceive a problem, but sometimes the problem is the real problem is something else. And in this case, you needed hygienists, but the problem wasn't getting the hygienist. The problem was housing the hygienist.
So not the so the So the hygienist drove from Johnson City, but the dentist,
So tell me how that, like, you perceive that problem. Like, you made that sound easy, but you built a dormitory for 14 traveling dentists to stay here for 2 weeks.
Mm-hmm. year round.
Yeah. So how did
that's been
how did
really
that happen?
a great thing.
So
well, we used to be on Memorial Drive because that's where Bristol Memorial Hospital was. And so my uncle, Dr. Fred Vance, who I've mentioned, who was my dad's older brother, and his two partners, Ben Cowan Sr. and Fred Greer, donated their office building to us. And the reason was the hospital was torn down, which was across the street from there. Bristol Memorial Hospital was torn down and moved. So they gave us their office building. Beside the office building was this little house. And we said that would be, the first thought was that'd be good to add on, but thank goodness we didn't do that. Our second thought was that would be a great place for students to live in and walk next, it was so very close. You could almost touch both buildings. And so that's what we did at first. We had to add a bathroom. And so when we started with UT, we said, we'll house them for free. Y'all provide the preceptor. So the UT's financial part of it was they pay a full-time dentist to supervise their students. We pay all the dental supplies. We pay all the housing. Occasionally we feed them. But basically, once the students get here, they're responsible for their own food.
Yeah.
For a while, maybe 7 years, they stayed in the little house and they loved the house. Then we did a $4 million capital campaign and moved our clinic. And Dr. Fred Slaughter was hugely helpful. He sold us his building for very little. It was very helpful. Then the students would continue to stay in the little house and would walk through one property, and then they were there. It was very close. But then the real idea, one huge idea for the dormitory, because the 2-bedroom, 2-bath house was working really well and the students loved it. And so I said, let's build a dormitory, but I was really nervous about it because the students loved the little house so much. And they had a charcoal grill and just their privacy and it was so fun. But I had a couple of the students, every time the students would come and go, we would give them a comment card and continue to do that. And so I remember one student dentist in particular who said, I'm married. I'm not comfortable staying in a 2-bedroom house because half the students are female and half are male, and he says, really, I kind of feel like he was saying it's against my religion to stay in a house with women while I'm, so he paid for a hotel room for himself for 2 weeks. He paid a hotel. And then I had a girl tell one of the female students another time, I was asking her, what do you like about it? And everybody just gave it a 10 out of 10. But she said one thing, and UT would send males and like 2 males and 2 females or 4. You weren't sure who was going to show up, except you did know it was either 4 men or 4 women or 2 and 2. That's just how it was. And so a female said, I was uncomfortable walking in the house. After I took a shower, I had to walk down the little hallway into my bedroom. And I said, okay, we're going to build a student dormitory that looks like a hotel room, in that when you walk into the bedroom, it's like you're in a hotel room. You walk in the hotel room, you have your bathroom, your private bathroom, we have a TV on the wall, we have beds. So it looks like a hotel room. And the students, thank goodness, they love it more than the house.
How important was that particular building to the growth of the clinic?
Oh, it's huge. Huge.
Yeah.
Every year we have 75 dental students. So we've done that for 10 years. So 7,500. So we're really educating. But another huge part of that that's so great is while the students are here, we talk to them about moving to Bristol. And so we have hired 4 in 10 years. Healing Hands has hired 4 of the dentists, and then they've stayed in the area. So there's a grant through the state of Tennessee where you can get a $50,000 sign-on bonus if you sign a 2-year contract with us or other people. And so that was big too. So Dr. Dylan Christian, that's down the street on Edgemont Avenue, that bought Jeff McMillan's practice. So he was our first student. So he's not far from Tennessee High School for anybody listening that knows this area. So he was our first, worked for us for 2 years, and then bought Jeff McMillan's practice. Then our second one was Michael Fuchs, and he has now bought into a practice. He worked for 2 years and works in Johnson City. And then we've had third and a fourth. And our fourth one is getting ready to start in July.
And you recruited this talent.
Yes.
Yeah.
So that's huge for Bristol. It is really hard to get dentists to move to Bristol. They want to go to Nashville or big city or home to Arkansas or wherever they're from.
Healthcare providers in general for more rural areas, it's an epidemic that I don't think people, I hear physicians talking about it, but I don't hear it talked about enough.
Yes.
What is it? So it's really like this. I think people's perceptions is you do a clinic and people come and get their teeth cleaned and blood drawn and that. But there's the important stuff is what you're talking about now. It's like it's bringing the talent, it's housing the talent, raising the money, creating the vision.
Yes. And then not only do the four live in our community, but they also continue to help Healing Hands. So Dylan Christian, our first student that we hired, is our volunteer dental director. Michael Fuchs was our second, and he continues. He's on. He'll come and be an adjunct faculty for UT as needed, and he helps serve on our dental services committee. So we're really fortunate that we're attracting people to stay here, and they're continuing to help us.
Yeah, you got real advocates in the community, creating traction.
Yes.
What is it that makes it so difficult to recruit medical providers?
Well, to a smaller.
Bristol's not tiny, but
they think, and I'm just saying what I've heard from the dental students who are in Memphis. They think Bristol is so far away and it's so small, and there's not enough for them to do in their minds. And one female said, "Oh, I could never find a husband there. It's too small." So, everybody has their own opinion. And they all say they want to go to the big cities where there's so much more to do. And then they also say, "Oh, I want to go home," or I've already know that in my hometown that my dentist told me come back and work with me, and then you can buy my practice. So we work hard to try to help them realize that Bristol's got a lot to offer. So we work hard on that.
Yeah. You made all that sound really, you've made that all sound really easy. I heard a lot of people involved, a lot of
tremendous.
And what you talked about before, what skill did you have in your early 30s that you may not have been aware of? That connecting people, those relationships. It sounds like that was the secret. That's the secret sauce, right? I can just see you. I can see those conversations happening effortlessly for you. That's a super skill, right? How did you do those? You had to sell so many different people. And we're not even talking about the administrators at UT Knoxville and UT Memphis that had to get behind this. Did you create a bigger vision that you were able to articulate to them that they wanted to be a part of it? How did you get that many people on board with this?
I think, a huge thing that helps people get on board with us is just the need. The need continues to grow. You want to help. Most people want to help people. And so there is tremendous need here.
Yeah.
And I just think that. And then once people get involved, whether they're a nurse or in whatever area, they love it because they feel so valued. And the patients, oh gosh, they cry or hug them or appreciate them. So the volunteers feel so valued too. They feel like that they are really doing something they need to be doing, helping other people. It's just such
purposeful work.
Yeah, and that helps.
Probably not a difficult story because everybody's aware. Yeah, everybody's aware.
And have you ever had a toothache? I had a horrible toothache, and I called my dentist and used my dental insurance. Got in that day, but there is so much need because there's not enough dentists. Especially in rural areas.
Yeah,
there's not enough dentists. So I just remember I got in that day and took care of my pain. But a lot of people that don't have dental insurance have dental pain, and they have to wait and wait and wait with that and live with that dental pain. And patients would say, I can't eat and I can't sleep and I can hardly talk because of my dental pain. And they go on for a long time with dental pain.
And the ones providing that care are typically fourth year dental students.
So yes, so we
that are housed in the dorm.
So we have a full-time dentist. We have 2 part-time dentists. So let's call that, you could call it, it's a little more than 2, I guess, and then the students, and then volunteer dentists too.
Wow.
So that helps. And then medical is similar.
This is just dentistry. This is
dentistry.
One part of what Healing Hands does.
It's our busiest part. The biggest need
the
is
dental
dentists.
Is the biggest
Dentist
need.
By far is the biggest need. We have started taking TennCare and Virginia Medicaid for adult dental. We don't help children because we just are doing all we can to help adults, and children in need have access to TennCare and Medicaid and Virginia Medicaid.
Is it because dental is, if you lack resources, dental isn't the priority?
Mm-hmm. You mentioned the word culture. If your parents didn't teach you to brush your teeth because they didn't brush their teeth, then didn't really understand the importance of brushing your teeth.
Yeah.
So a lot of people, or some people, have ruined their teeth by substance misuse.
Yeah,
that's a big problem in our area too. But
are you seeing more? Of that?
Yeah, there's some. Mm-hmm. We see some. Yes, unfortunately.
Yeah. Is it particular drugs that are causing that?
I think meth is huge.
Yeah.
A lot of people ruin their teeth from that. One thing I wanted to add is I said all the services we provide, but currently we've wanted to, this has been a dream, to add mental health services and help people with substance misuse. But really, we have, I'd say 40% of our patients are depressed and have anxiety. Some are alcoholics, some are drug users, but a huge thing is depression, or people that just need somebody to talk to, or people just need help.
You've seen that, like you've been there for 21 years, and you say it's one of the biggest dreams that you have now.
To add mental.
Has that always? I'm curious. Is your perception that need has always been there and we didn't recognize it before, or is it something worse. That
especially COVID, huge numbers increased because of COVID. A lot of people, because of COVID, have mental health problems.
I have heard that from people that I really trust. Like the athletic director at the local high school says this. He says, you will be surprised at how unhealthy kids are right now since COVID. Like people that aren't in the schools just don't understand. So it's like, I'm hear people in the trenches keep saying this.
Yes. So what we've chosen to do is we have decided to do our 3rd capital campaign. Everything I'm talking about is money, but we always need more money. So we have purchased the building beside us on Midway Medical Park in Bristol. And we also applied for, and thank goodness received, a grant to hire our first full-time psychiatric mental health nurse practitioner, plus a psychiatrist to supervise her. So we've just hired the nurse practitioner, they say psych NP, and her supervisor. So that's huge for us. We're getting ready. We're waiting on their paperwork, their liability coverage, et cetera, and we'll start in July.
I found that overachievers make what they do sound easy, and you keep doing that.
Well,
what you just described. What you described is a lot of people's life work. And you went through it in like 2 sentences.
So it was huge that we got this.
I want to back up and know how you accomplished this. So the dental piece, the residence piece, the building, the dormitory, that sounds like that was early on. Now there's this. The more you work with people, the needs change. You see the need for new solutions. Mental health. Is this a vision that started 5 years ago, 10 years ago? Like, when was the seed planted?
I'm not going to say it was the whole time I was there. And really, it wasn't all me. I don't at all mean to say that because, like you said, it takes a village. COVID really showed it needed it. that's when when we went, I say we went through COVID. I know people still get COVID, but it was COVID that really made us say, we have got to found, some people say behavioral health. And so we have a lot to learn. And the psychiatric nurse practitioner is going to be tremendously, I know she's going to be very successful. She's very easy to talk to. She's met a lot of the patients. They all love her. We're thrilled to have her.
So you recognize this need, 4 years ago during COVID. This is the next thing that Healing Hands needs to tackle.
Yes.
What do you do first? Do you get certain advocates in the community? Do you put together a large capital campaign? Tell me how that progression happens. Because a lot of people with big ideas and want to do big things, they don't know, like, the money's important. How do they get from here to there?
Yeah. So I think the very first thing we did was ask the owners of the building next door, can we have first right of refusal on your building? Because I haven't mentioned this, but in medical, we added, so we have a great medical director. We want to grow our medical program. We have a need to grow our medical program. And ETSU Health has hugely helped us, not only the dental hygiene, but now I'm talking about in medical, the Quillen College of Medicine. So they've come on, and their residents come every Wednesday and Fridays. And that's been huge. So we just have had this drive to want to grow medical because dental just really took off. And so we knew we needed more space if we were going to do behavioral health. And so we have a medical director, a few volunteers, but we knew that we wanted to grow medical. We wanted to add behavioral health. So one huge thing that we learned about from ETSU, Jody Palaha, she taught us that the best way to integrate behavioral health into your medical program is called the warm handoff. So right now, we've been saying to patients, or the doctor would say, I want to refer you to like Frontier Health, or I want to refer you. Here's a piece of paper, or maybe they would make their appointment. And there's a lot of no-shows with that. And once the patient leaves, they, aren't real likely to go somewhere they've never been to. And so it's called the warm handoff, where the physician said, does the primary care appointment, and he or she says, I'd like you to meet Courtney. And Courtney is close by. Her office is in that same area. And Courtney, who's the psych NP, comes in right then. So you're really establishing a relationship right then and there. So it's really a primary care appointment, and you're starting the mental health program.
And the key to that is they're in the same space.
They're right there together.
So when you say space is the biggest need, you're talking about space, right? It can't be space on the other side of town.
Yeah. So what we're going to do is we're raising money, and probably in a year and a half, we're going to move all of medical and behavioral health and our vision clinic, and also our 3 community health workers. I wanted to talk about them, but move all of that into the same building, because right now we have 3, but we started out with 1 building. Now we have 3 buildings. And so the dormitory is on the bottom floor, and the upper or main floor is offices, because we've grown so much, and then this huge office, a huge meeting room. So we added community health workers, and we have 3 of them. And it's a little hard because they're across the street, but it's fun. It works really well for now, but it'll be great when they're integrated too. So a community health worker is very similar to a social worker. So okay. I'm familiar with social workers at the hospital. I don't know.
Yeah.
And then they help you with your discharge plans, sure. And they stay right there in the hospital and work with you and connect you. But community health workers they have lived experiences, so they can relate to the patient. And so the patient really feels comfortable with them. They also are very knowledgeable about what all is in the community to help people. They don't necessarily stay in the office. They go to their homes. They may go with them to, one of the community health workers said one of her patients had got to go to the YMCA, and she just couldn't make herself go. And she said, come on, I'm going to go with you. So they went together for the first time. community health worker and the patient went and exercised at the Y together. She would have never gone on her own.
Yeah.
Somebody, when people miss their appointments or are no-shows, the community health workers will call them and say, hey, Matt, I saw you missed your appointment today. What can I do to help you make your next appointment? And they'll say, oh, it was my transportation or my ride or whatever. And so that really helps them. But it shows them that they are valued, and they talk to them about, they give them it's called social determinants of health screening. Do you have enough food to eat? Do you have transportation? Do you have a home do you have a place to live? So, if you help people with those things, their social needs, it helps them get better. We call it helps move the needle. They are hugely helpful in helping patients get better, because really that's what we want. We want the patients to get better.
The medical need, whether that's the toothache or whatever, that's not an isolated problem. It's connected to other problems that you're describing.
Yes. So I'll give you an example. We had a female patient who was coming to talk to our medical director. And we have such a great relationship with Bristol Regional Medical Center, Olive Ballad. They signed on with us day one. Before I got there, they were on board because we help people stay out of the emergency room and out of their hospital stays, uninsured. They, if you don't have uninsured, you can't pay those huge bills. So, but our medical director was helping a female patient who kept complaining that her back was hurting. And so they ran all these tests and tried to figure out. And then when the community health worker got involved, and she said, I want to come to your house and I want to meet you. So they go to people's homes and see how they're living. So she got to her apartment and she didn't have a bed. So it turns out the community health worker was able to get her a bed that same night. And that's why her back was hurting. So, had the community health worker not helped her, they may not have figured it out. Well, you're sleeping on the floor.
The physician would never have asked those questions.
And she was too embarrassed to say to the doctor, well, I don't have a bed. Maybe she didn't think about it. I don't know. But so that's a really good example of how community health workers can help patients get better and they help the physician help the patient.
It seems like, just hearing your tone, it sounds like this is a really important part of the solution.
It's a huge part of it.
Because if you just fix the one thing, there's something else.
Yes.
It's probably more important. Like the bed is more important than the backache.
Yes. Right.
The back pain, right?
Yes. Just one other example, that somebody was missed their appointment and the community health worker called him. And she said, or she went by his house. I think she couldn't get in touch with him. And she went by his house and said, you missed your appointment. What can I do to help you? And he said, well, I got this new cell phone and I don't know how to work it. So she taught him how to use the cell phone so that he could call and make appointments. And, so people need a lot more help than what you may realize.
You said she got a bed that night.
Mm-hmm.
I think that's an important detail.
Mm-hmm.
So when you look at organizations as large as yours, there's a lot of times a lot of bureaucracy. How did you empower that community health worker to solve that particular problem so honestly, quickly?
I had nothing to do with that. Community health workers have a group of, they are very well networked and they're very well educated. They know she knew who to go to, she knew who to call.
So she was empowered to solve that problem on the front lines. It's not like she had to put in a PO request and it went to a committee that decided whether or not this was.
I think she might have called a church. She knows who wants to help, what churches. So I think it possibly was a church. It might have. I'd never even asked her because, they handle that so beautifully that I just know she got a bed.
It probably happens. Stuff like that happens every day, right?
Yes.
That's real solutions.
Yes.
And a lot of organizations aren't able to do that. I think the speed.
Yeah. I do not micromanage everybody. We've got a really great, very hardworking staff. So 27 people, are really working hard. We've got a great board of directors too. They don't micromanage or.
To do what you guys are doing, a lot of things have to be functioning at a high level. What's important about the boards? Like, if you were starting a nonprofit, what's important about the board's role? Like, what should they be doing? What should they not be doing?
Okay. What I'll say is every single board meeting, we talk about our finances. Every board meeting. And we have 10 board meetings a year. It's monthly, except there's 2 months that we don't meet.
Okay.
So I think board members need to really keep an eye on finances. That's huge because that's just a huge part of it. They should not, I use the word micromanage, but they should completely stay out of operating. They should not have anything to do with operating the clinic. So that's up to the executive director. And then advocating for the nonprofit is huge. Do they know people who could help us, or just when they're talking to friends, or if they're at church? I'm on the board of Healing Hands, being true advocates. And this is what we're doing. And we found we had a patient who didn't have a bed, and we were able to get her a bed that night. Just advocate and promote.
Expand the network of relationships. Mm-hmm. It's like when I hear you talk, like you throw out these relationships that have built the thing. There's so many of them.
Yes.
And so you're saying the board's primary role, like a board member's primary role in a healthy nonprofit, should be to expand those relationships.
That's
to
one
advocate
thing.
For you.
And they have financial oversight. And they're all on a committee based on what they might be doing in their own jobs. We have an executive committee made up of our officers. We've got a personnel committee or a human resources committee. Building and grounds, I have people that help me.
How many are on your board?
So we have 13.
Okay, 13.
And
each one of them has a different kind of expertise. Do you recruit? Do you recruit based on expertise?
Mm-hmm. Yes, we do. We know what type of person, like if you can stay on the board. It's 2 3-year terms. It's a 3-year term. You can be asked to serve another 3-year term. And then, so like if we are losing somebody off the finance committee, then we look for a CPA or a banker, so it is strategic.
In retrospect, 21 years perspective, do you think it's healthy for the board to cycle?
Yeah, I do.
Yeah.
Mm-hmm. It helps more people learn about Healing Hands. It widens your circle.
Yeah. Yeah. So rather than the same 13 people for 10 years that keep renewing terms, it's just a healthy thing. Mm-hmm. So you said these, and I want to go deep here just because I think there are so many nonprofits out there that are not functioning at a high level. And I think this is really important. The board is an important role. I don't know that they're always leveraged well. Mm-hmm. And so you have 13 board members. They all have skill sets. They're creating relationships. But then you said they're responsible for a committee.
So everybody serves on a committee.
Is the committee, how big is a committee typically?
So a committee's not real big, but our largest committee is our dental services committee.
Okay.
So we have a medical committee that's now going to be medical / behavioral health, dental. The dental services committee is our largest one. Very active because dental is by far it's our number one request for need. So I've always said this, 8 out of 10 people who apply for services at Healing Hands are asking for dental help. That's 80%. And sometimes it seems like it's 90. It's just hard for people to pay. Going to the dentist is very expensive if you don't have all of our volunteer dentists, our staff dentists, our staff dental assistants, and then some of our admin team. So there's probably 12 of us on the dental services committee. Then other committees might be like 4, 5, 6. Medical is the second largest committee, and it's board members, our medical director, just different people that help with medical.
Are the same people serving on multiple committees?
We've had a couple of people that are on a couple, but primarily no.
You try to, so that means you're reaching outside your board. And so a committee might be a board member, but it might be 3-4 people outside the board.
Yes.
In the community.
Yeah. So our bylaws require us to have at least one board member on the committees.
Okay.
And to serve as the chair of the committees.
And so that board member is expanding relationships. They're bringing people into those committees. Those committees are doing the really heavy. They're doing the heavy lifting.
Yes.
You're not doing that heavy lifting during the monthly board meeting.
Yeah. So the board meetings last an hour. So it's not like it's a long, we are real organized. We have an agenda. A lot of people report. At the beginning of the board meeting, we have a prayer. We will have asked somebody to come do, we call it a mission minute. So there's some kind of educational thing, or maybe a patient wants to thank the board, or, we just introduce the board to somebody. And then we just talk about what all has happened since the last board meeting. And, I think the board is helpful with when we need help, when we maybe have a problem, or we've had something's come up that we would like their advice, and what do they think? They're helpful with that too. Mm-hmm. So we report, but also get their feedback.
So this the mental health vision, do you start with a board member who shares that passion?
So we do have a board member who shares that passion. It's Dr. Martha Wyke, who grew up in Bristol, lived in Knoxville, and has moved back. And she's a retired psychologist.
Yeah.
So, and then Kathy Keene has been, they worked together, and she's on our board too. So hugely helpful.
I think some people make the mistake of thinking that they have to rally all the troops, like leaders have to rally all these troops, and it becomes daunting. But really, all you need is to rally a few influencers, right? And then let the influencers, the influencers really...
They're the experts,
And they're if you get the right, if you convince the right influencer, the right influential person, then they run with that.
Yes.
And that's how you scale you went from 3 employees to 27 in all of these facilities. Like, you don't get there by doing all the heavy lifting yourself. You're empowering other people.
Right. Most definitely.
And
we have a great admin team too. Just tremendous, tremendous staff.
Yeah. It would take it, like with all that you're doing. Tell me your typical problem in 2024 that might surprise people how prevalent it is.
Well, that would surprise. So my first thought was, fundraising. I'd like to say this, that when I was talking about the community health workers, we have 3 community health workers who were funded by with COVID money. During COVID, there was a lot of money coming from the government to help. And so that's how we were able to fund our 3 community health workers. So that funding is drying up the end of this year. So that's part of why it's really on my mind to really drive home how helpful they are, because their funding is running out at the end of the year. So that's really top of my mind right now. How are we going to sustain community health workers when the 3-year grant has ended? And, it's not like they didn't know it was a 3-year grant. They knew it was a grant funded position, but that's the hard part about grant funding is what are you going to do when it runs
sunsets,
out?
Yeah.
So a couple of things we're doing, we're asking people if they can become monthly donors instead of just once a year. That's huge. People can donate on our website. And then we're going to start a mission breakfast, an annual mission breakfast where it's August 20th, and it's at First Presbyterian Church. And we just want people we want to create awareness about Healing Hands, because until you really come in for a tour and really see it, you do not understand what we do. We look just like a regular doctor's office. We look like a regular dentist's office. People are surprised at how nice it is. It's really high quality, very nice. But we're looking for funding for our community health workers.
Are the needs increasing?
I think so.
Yeah. It's not just that, like, mental health is something that needs more resources, but the number of people as well.
Yeah. And then, there's such stigma around mental health, so we're trying to figure out how to help with the stigma. I think it's better than it used to be, but we really want to work on the stigma of don't be ashamed, or it's not your fault, or that's something that we really want to work on too.
You think people that are suffering from that are unaware, or
and a lot of times it's not their fault. They're embarrassed, or they wouldn't want anybody to know they were going to go to see a psychiatric nurse practitioner, or a lot of people try to hide it. And it's affecting so many families, so many. So I just feel like it's such a great need, and it's grown a lot.
I know you mentioned COVID. Do you feel like there's cultural factors behind this epidemic?
So I think there's cultural habits behind all that we do. I mentioned about dental. A lot of people do not take care of themselves. And maybe their parents didn't take care of themselves. There's a fear of finding out. A lot of people don't go to the doctor. They don't want to find out what's wrong. They don't want to find out. A lot of people think, oh, I don't have the money, or I don't want to go to the doctor. So it's cultural. I think it's cultural. People aren't taught to take care of themselves, or there's a lot of people, overweight and obese is huge in our clinic too.
Yeah. Yeah. I'm curious, like you've done so much. Like we probably haven't even scratched the surface, and we've talked about such big problems that you've come up with solutions to. It's never completely solved, right? But you've definitely made a dent in it. And when you look forward to the future, it sounds like the mental health piece is
that's our future.
That's So when you look at Healing Hands 5 years from now, dentistry is 80% now. What do you think in the future mental health should be?
40% of our patients have behavioral health or mental health needs. So it should be at least 40%, because since it's going to be integrated with medical, we started taking TennCare and Virginia Medicaid for adult dental. We are working on that now for medical and behavioral health.
So when you look at obviously the resources to commit to it, the community health workers are probably a big part of what other are the biggest problems to solve? Like with dentistry, with the dentist, it was the housing for the dentists. For mental health, what do you feel like is the biggest obstacle between here and 40%?
Stigma.
So really?
A lot of people are being too prideful or not wanting other people to know they have problems. So stigma is huge. They're worried about what other people think, and what if I admit that I have it? That's big.
Yeah. Wow.
And a lot of people keep it to themselves.
How do you move the needle there?
I think it's education. Just trying to educate people. Yeah. I think that's a huge part of it is education.
And is it education there on site when people come in, helping them understand that it's not just the toothache or the backache? Maybe there's something else? Yeah.
So I think it's, educating the patients, but also educating the public too. Yeah. So the one thing the community health workers do is, I believe it was last year, so 2023, they did 52 outreach events. So that's one a week, you know, and educating the public and passing out information, not only about Healing Hands, but about mental health and how to get help and dental help and medical help. So they educate the public. That's one way they educate the public. And then just spreading the word, any way they can through marketing or any kind of interview. So we work hard on trying to educate the people in the public too.
Yeah. It's so interesting how you've avoided like silos, like the dental problems aren't just dental, the medical, it's like this holistic approach. Mm-hmm. I think traditional medicine hasn't been very good at that, right?
Yeah. Mm-hmm. Yeah. And then we have a food pantry, small food pantry too.
Why not?
What you eat. So, what you eat is so important.
Yeah.
And another thing a lot of times when you go to the doctor, they don't talk to you about what you eat and how you need to eat right. But so we have a food pantry. The community health workers handle that. And we also have a partnership with UT Extension where they will do cooking classes, teach you how to eat healthy, teach diabetics what they need to eat and not eat. So that's an important part of it is what people are eating.
So at some point along the way, you just call up UT's dietitian center and say, we got this problem. We think we can work
and
together
they do
to solve.
Other education.
But for real, does it start with a phone call? Like they don't just call you out of the blue offering a partnership.
So we've done it for so long. We even used to have Weight Watchers at Healing Hands. So I'm trying to remember how exactly we started, but So the Sullivan County Health Department, we have a great relationship with them, and I think they potentially connected us. They've been helping for a long time. So relationships are everything.
Like you're solving these big problems, and the answer is always some relationship.
Well, and then so Healing Hands is, people say, are y'all connected to any, is there just one? So we are one Healing Hands in Bristol, and we are part of the Virginia Association of Free and Charitable Clinics and the Tennessee Charitable Care Network and the National Association of Free and Charitable Clinics. So staff and I go to conferences, which has been hugely helpful for networking, meeting other executive directors and talk about, problems and how did you solve this? So learning from other clinics has been a huge part. We educate on what we do. Other people educate us.
Yeah. So, and there's all those relationships. And it seems like the front line that you're discovering are those community health workers, because they're the ones actually going to the home, recognizing that the problem is not the back. The problem is the lack of a bed.
Yeah.
And solving that problem that day with community resources, using relationships to bypass all the bureaucracy. Like that is a beautiful thing. And then you say the community health workers also run the food pantry. That's not a small thing. So
and they get churches to help with that.
Yeah.
So churches are a big part of what we do too.
Relationships.
Yes.
Right. Yeah. It's like, I think maybe it's different in bigger cities, but in small towns like Bristol, I've always said, to get big things done, you have to collaborate. Like nobody in a smaller place has the resources to do big things or create big visions. You have to You have to collaborate. We
are also a United Way of Bristol member agency, partner agency, I think.
Right.
So yesterday was the United Way Week of Caring Day for us, and so Ballad chose us. We had to write out, what we needed. We needed landscaping. So we had, because of our partnership with the United Way of Bristol, we had employees of Ballad came and did our landscaping for free, and they got paid for being there. It was their day that they instead of being at work, they were able to do landscaping for us, and different churches come and do landscaping for us too. So it just takes a lot of different people. So every day's different.
Yeah. Well, gosh, what you're doing is really important work.
Well, come for a tour. I'd love to show it to you.
Let's do it.
It's really something to see.
Let's do it.
Amazing.
I've gotten into these conversations, and you drive by places in town. You drive by them every day, and it's a building. You have no idea the amazing people doing amazing work inside those walls. And that's what's been most enjoyable about this podcast, is I get to dive deep into what's happening in there. And it's fascinating. It's incredible stuff. What's going on.
Yeah.
So thanks for being such a important part of the community, and
thank you very much.
Continuing to grow Healing Hands.
And I appreciate, all the people that help us too. It's just incredible.
Yeah. It takes a village.
It does.
Yeah. Thanks, Helen.
Thank you very much.